Hey guys, it's Dr. Nelson. We're talking about things we help with that a lot of people don't expect chiropractors could help with. We're talking about numbness and tingling here. Now, some people might know about this. You might have had a nerve issue or a disc issue in your neck or your back that referred down your arm or leg. You went to see a chiropractor, maybe got some decompression or some traction therapy, some great adjustments, and found some relief. If that's the case, that's awesome. You might have had a friend go through this as well. Those are things that are more common that people know that we can help with. Here are some other things that we can help with that you might not know that we can help. So let's talk about some of the causes of numbness and tingling. The thing here is that numbness and tingling is a symptom. It's not an actual diagnosis. It's not a cause. So for instance, this is not a diagnosis. This is a symptom, something you feel. That could be a sign of a different problem. In fact, multiple different problems. Let's talk through some of the things that can cause numbness and tingling. You could have a spinal issue. You could have a metabolic issue. You could have, for instance, diabetic neuropathy. Very common, one of the leading causes of nerve pains, numbnesses, and tingling, burning, shocking sensations. Okay, you could also have gone through chemotherapy. That's one. You could be on a certain prescription. I'm not going to name the prescription because I want my video to stay up on YouTube. Okay, and then let's see. Those are some good ones to talk about here. So, stroke. There we go. That's the other one I wanted to briefly touch on here. So, let's talk about these for a minute. So, if you have a spinal complaint, one of the first things I'm going to ask is, where do you feel the numbness and tingling? That's going to provide me with so much information, and I'm going to listen to every word you have to say because your input is hugely helpful. Trust me, you've spent more time with your body than anyone else, and don't let any doctor make you feel silly for giving him or her the information that only you can give. Please, all right? Give yourself that trust and that pat on the back. So if someone tells me, hey, it's just in my right arm, I'm probably looking right here. If they're telling me it's in both hands but not in the feet, I'm still looking right here. If they tell me it's in both hands and feet, I'm looking several different places. If they tell me it's just in the feet, I'm gonna be looking at their low back because the hands are not involved, okay? So that's how we could figure that out. I'm gonna ask about car accidents. I'm gonna ask about whiplash events, falls, major traumas, and other issues of that sort, and whether or not you are at a desk all the time and you have horrible posture and you answer the phone, with your shoulder up here, and type and high stress, that might lead to some problems. Next, metabolic. If you're diabetic or pre-diabetic, and you don't have to be full-blown diabetic, and you don't have to be diagnosed with diabetes to start having some of these issues. Too much sugar kills the nerves. A lot of that nerve function can be gotten back depending on how far it's gone. So there's a lot of hope there. I've got a lot of articles on my website talking about neuropathy, and a video that is just phenomenally talking about the top 10 signs of peripheral neuropathy. If you're interested, go watch that, go enjoy that. I think you really will. One of the top causes of peripheral neuropathy is actually chemotherapy treatment. So if you had to choose between numbness and tingling and dying of cancer, I think I would choose the numbness and tingling, and a lot of people do too. One of the things they don't know is that chemotherapy is really hard on your B12 levels. And so if you're not already supplementing a B12, especially something called methylfolate, we'll put this in the description here because I have doctor handwriting. If you have methylfolate and methylcobalamin, this is a B9, and methylcobalamin, that's a B12, taken underneath the tongue in high doses, these can help with a lot of neuropathies just on their own. Cheap, easy way to find out, go add it to your diet. It's food, okay? So, certain prescriptions, it's a side effect. You can look these up. Again, I don't want the video to be taken down. I'm not gonna name it right now, but it's very famous and it particularly helps with cholesterol. Moving on, strokes. We can't unstroke someone, but what we can do is help their body and help the tension and the inflammation on their nervous system go down drastically, and that will help their body have the best chance of reconnecting some of those pathways or finding other ways to be able to compensate depending on the nature of the stroke that they've had. We had a patient who had a very near catastrophic brainstem stroke to the point where he was not able to balance properly, wasn't able to go to the golf course, swing a golf club, because he didn't feel stable. And what we were able to do for him is help not just with numbness and tingling, but help him be able to actually go out and chip and putt again, which got him on the golf course. And it was so exciting to see that. So guys, I hope this video was helpful. This is obviously not an in-depth conversation on numbness and tingling. Again, if you're curious about neuropathy and other sorts of things like that, check out that top 10 signs video. Like, comment, subscribe, check out the playlist with other issues that we can help with. And if you know somebody who needs to see us, send them our info. Thanks, guys.